Hello, ladies and gentlemen. Welcome to Triple in Media. I am Dr. Nik Nikam. This presentation, we are going to look at diastolic dysfunction in patients with atrial fibrillation and in patients with low left ventricular ejection fraction. Okay, so let's begin with the feature presentation. We are going to first focus upon diastolic dysfunction in atrial fibrillation patients. So the diastolic, when we are looking at diastolic dysfunction in patients with there are a few parameters we are focusing upon in terms of how they differ from diastolic dysfunction in a patient, the normal sign rhythm. But before I go into that, I want to give you the basis of my presentation, and let's go back to my presentation here. And if you go to Amazon.com, you can take a look at the book I have written, Echocardiography and Doppler Reference Guide, 404 pages. It's less than $30, and it has a chock full of information, tons of information about normal, abnormal values, and in what conditions they are increased, what is the extent they are increased, with all numbers and statistics, so that you will be quite impressed with the information that you get in this 400-page reference book. Keeping that in mind, I'm going to walk you through a couple of chapters on atrial fibrillation and also patients with low ejection fractions. So let's start off with patients with atrial fibrillation. So here is my actual book, which is, of course, Word format, where it was put on Amazon.com, is the diastolic dysfunction, low ejection fraction. This is exactly what you would see if you buy this book. And it shows you all the numbers that you know. And let's start off with the atrial fibrillation. Some of the key features of diastolic dysfunction in patients with atrial fibrillation is like in patients with atrial fibrillation, if the peak E velocity is greater than 50, it suggests left ventricular filling pressure. And it's the same thing in patients with low fraction. The E velocity has to be measured over 5 to 10 cardiac cycles. Then we can also look at deceleration time. The deceleration time is less than 250 seconds, just elevated filling pressure. Again, we have to measure that over 5 to 10 cycles. Then E to prime ratio of greater than 13, elevated, and again, you have to measure multiple cycles. Left atrial volume, which of course is a reflection of a chronic elevation of the end diastolic pressure or left atrial pressure greater than 34 ml meter square. Then IVRT. If the IVRT or isovolemic relaxation time is less than 65 milliseconds, again, it's elevated filling pressure. And finally, we have, if you have an E velocity of E to velocity of 1.9 meters or 2 meters, then it suggests elevated left ventricular pressure. One more thing that is not mentioned here is the pulmonic time ratio, which already talked about E prime ratio. That is indication, and especially if the E wave is less than like 7 millimeters, 6 to 7 centimeters per second, that in itself indication of elevated end diastolic pressure or left atrial pressure. So these are pulmonic flow reversal, where the diastolic will be bigger than the systolic wave. That's another indication. Summing the whole information that I just mentioned, textbook here is slide format, diastolic dysfunction, atrial fibrillation. We don't have E-A ratio because that is not there, but we do have E prime ratio of greater than 30, 15, especially of elevated left ventricular pressure or diastolic dysfunction. Mitral deceleration time of less than 50. We talk about mitral velocity, low ejection. Talk about side, left atrial size, tricuspid regurgitation of 0.8 meters. covered in that chapter, and pulmonary vein systolic diastolic reversal ratio. Again, if the IVC greater than 0.1, 50% compressible, that's another indication of elevated right heart pressure, which may be an indirect evidence of elevated left atrial pressure. So that is keeping in mind all the factors that we need to look for in terms of the E velocity, the deceleration time, IVRT, the harmonic, systolic, and diastolic waves, E velocity, and tissue Doppler E velocity, and all these numbers plus tricuspid regurgitation, left atrial size. When we bring all these things together, we can indeed diagnose diastolic dysfunction, elevated left heart pressure in patients with atrial fibrillation. Let us switch gears and look at what are some of the parameters we can look for patients with low ejection fraction. Let's go back to my textbook here, and let's looking at the chapter on diastolic dysfunction with low ejection fraction. Of the first parameter is, and in patients with low ejection fraction, they could be in sinus rhythm. In that case, if you have a E to A ratio of less than 0.8, maybe indicate grade 1 diastolic dysfunction. And of course, same scenario as you go in patients with normal ejection fraction, grade 3 if the ratio is 2. Deceleration time less than 150 milliseconds suggests you have grade 3 diastolic function. Same thing with the IVRT, less than 60 milliseconds. IVRT is best measured in the tissue Doppler at 100 centimeters per second speed. Then E to E prime ratio of greater than 15. Talked about left atrial size greater than 32 ml per meter square, and pulmonary flow reversal, systolic diastolic reversal. We talked about tricuspid regurgitation, which is not here, that is greater than 0.8 meters per second. So when we put all these things together, patients with less than ejection fraction, and if you find these things, just summarize in this next slide here. Let's see if I can. So to summarize, in patients with the diastolic ejection fraction of, can use E to E prime if they are in sinus rhythm, and which yes, mitral E to A ratio useful, mitral deceleration time, mitral velocity, ejection fraction greater than 50 meters per. But keep that in mind. Ejection fraction of less than 50%, mitral velocity greater than 50 centimeters, that's an indication of diastolic, elevated left pressure, left size, vein. Of course, all some of the features which will help. Ladies and gentlemen, I have been watching a presentation on diastolic function in atrial fibrillation and ejection fraction patients. Hope this you subscribe to our YouTube channel. We have more than 300 videos related to echocardiography and cardiovascular diseases. Please do watch them and subscribe to our YouTube. Next presentation.